Good evening, everybody. It is June 22nd, 2023, Thursday. It is 9:06 at night. Okay, this is the answers and questions to questions most commonly asked about cognitive therapy and the self-awareness exercise in the Feeling Good Handbook. Doesn't cognitive therapy just lead to intellectual change without changing how a person really feels on a gut level? No. The purpose of cognitive therapy is to transform your emotions and your perceptions of yourself and your life. Providing rationalizations or intellectual excuses for things is not a part of cognitive therapy. The purpose of the treatment is to develop profound feelings of joy and happiness. Next question. What kinds of problems does cognitive therapy work best for? When does it not work well? Cognitive therapy is an excellent treatment for mood problems such as depression, anxiety, panic attacks, phobias, anger, guilt, and feelings of inferiority. The therapy can be exceptionally helpful for the kinds of problems that we all confront in the course of daily living. These include personal relationship problems, rejection, criticism, procrastination, and the fear of failure. The techniques can be extremely effective and often work rapidly, even without the use of medications. Cognitive therapy alone is not especially effective for severe psychotic disorders such as schizophrenia or the manic phase of manic depressive illness, as described in Chapter 3. Manic depressive illness is a cyclic mood disorder characterized by abnormal highs and episodes of deep depression. Manic depressives frequently need treatment with medication. Effective psychotherapy is also a crucial aspect of the treatment. Cognitive therapy can help manic depressives develop greater self-esteem so they can cope with personal problems more effectively. Next question. Is it normal to feel depressed and angry? Isn't it ridiculous to think that people should be happy all the time? One of the greatest misconceptions about cognitive therapy is that you should try to feel happy all the time. Negative feelings are frequently healthy and appropriate. Sometimes it's best just to accept bad feelings and pamper yourself and ride things out until the clouds pass and you feel better again. Next question. Isn't cognitive therapy just a little bit too simplistic? Just too good to be true? This sounds like the power of positive thinking. The principles of cognitive therapy are extremely simple. The treatment is based on the idea that your thoughts and attitudes have a huge impact on the way you act and feel. The actual procedures to change your negative thinking patterns, however, are quite sophisticated and require hard work. Next question. Do cognitive therapists promote the idea that you should make yourself happy and ignore other people's feelings? Some pop psychologists have created the impression that you should do your own thing and ignore how other people react to you. My own position is quite different. I believe that if you ignore other people's feelings, you will set yourself up for enormous problems in your relationships. Many people are self-centered. They don't seem to care about people and they use others to achieve their own goals. They often appear to be extremely happy and they sometimes achieve a considerable level of fame or success. In spite of the external trappings, however, they may feel lonely and insecure because they never learned how to accept themselves or to get close to others. I do not envy them. By the same token, there is a profound difference between wanting other people's love and approval and needing their love and approval. If you need love and approval, you may be too dependent on other people and feel terribly afraid of conflict or criticism. When someone is angry with you, you may be too threatened to express your own feelings because you are afraid the other person won't like you if you do. And you cannot truly hear what they say because their anger is so upsetting you. Like the narcissist who cares only about himself, people who need too much love and approval may be unable to develop mature, open, caring relationships with others. They end up feeling desperate and alone because they have not learned to love themselves. Next question. How does a cognitive therapist deal with subconscious attitudes and feelings? About 2/3 of the patients I see in my practice have straightforward problems that can be dealt with in a fairly short time, say 15 to 25 sessions. These patients find the cognitive methods helpful, and they usually get excellent results. About 1/3 appear to have subconscious fears that cause them to resist therapy. On one level, they want to feel better, but on a deeper level, they are afraid to change. They ask for help, but soon they resist the therapy. They complain that they aren't getting better, and yet they appear to sabotage the therapeutic process so that progress is extremely slow. For example, some patients refuse to do any of the self-help assignments between sessions, even though these assignments have been helpful to them. These patients can be a real challenge. When they become more aware of the subconscious fears that are holding them back, they often develop the courage to move forward with their lives. When they finally recover, it's a real cause for celebration. One of my goals has been to learn more about this puzzling phenomenon of resistance and to develop more effective treatment. Part 5 illustrates techniques that can help therapists motivate these patients and facilitate greater feelings of trust and rapport. Okay, so that is all for chapter 1, and that is all for the self-awareness exercise. If you liked this content, like this video or comment below. Thank you very much, and thank you for watching.